is Michael. I'm part of the Global Access and Policy team in Roche Pharma, and I'm super, super excited and delighted to have the opportunity to have a conversation with Ulrika, who is the president of UICC. And Ulrika, if you allow me to jump directly into it. Like, we know UICC is really the beating heart of the global cancer community. Since you became the president, like, what have you seen? What have you experienced? And very important, how are you feeling?
Oh, I'm feeling great. I'm super excited, and thanks for inviting me to this conversation. I really look forward to being able to discuss the future of global cancer control, and we're all united in our mission to actually reduce the global cancer burden. And you're really vital because you've been a partner to the UICC for many years, and I think we have a really strong partnership. But I'm curious about, because you've been really part of this partnership for a long time, and how come? Why do you think this partnership is so important to you?
So I grew up with a single mom, and I have two sisters, and 4 nieces, and 3 of them in Austria, a very rich country, were diagnosed with cervical cancer around that. So it's also, I think it's also important that we remind ourselves health equity, why it's so prominent and eminent in like the global south in those areas. We face health equity also in all the countries. You face it in Europe. If you look at the cancer survival rates between, sort of like Eastern Europe and Western Europe. So it's really a multifactorial problem. And I always coming back to private sector cannot solve it, NGOs cannot solve it, government alone cannot solve it. And I think there's a little bit to do also to create this awareness and overcome this. I have the solution. And then sort of like, I don't need you. And I want to build a little bit on what you said about the government. So I'm very passionate about, and I'm a firm believer that we can do better, that really cancer care specifically, just because of the impact it has on a patient, but actually on a caregiver and on a society. And with on society, also an economic growth, that we also need to find a way getting out of this confinement of the health minister. And we need to find a way to get the finance minister on board and the minister for education. Like, if you really want to address health equity, it's like, what are your thoughts around that?
Yeah, I totally agree with you. And I think it's all about, because I mean, cancer affects us all, either as patients or someone in our family or a colleague or a friend is affected and are diagnosed with cancer during our lifetime. And I also think in terms of when we talk about prevention, it's not something the healthcare system can solve. We need to have it connected to the education, finance. The finance ministry would be really onto prevention, because it saves money in the long term, and with the money we need to use to invest in the people who really needs diagnosis and treatment, and can have that of a higher quality in the end. So it's really so linked to how you also develop a society in infrastructure and everything in terms of prevention and in sort of productivity, not to talk only about, because you and I, we both know about that, the human suffering and having that, but we need to see the whole picture of how cancer really has an impact on the whole society, on all parts of the society.
So I think this partnership is really so important. Like, on the one hand, we see all this tremendous progress on the science side. We have become so much better, also with the help of UICC and with patient organizations, so much better in detect cancer earlier. We know so much more about the factors, this lead and impact if a person unfortunately is infected and affected with cancer. And actually, we have better treatments than we had ever before. Yet on the other side, if you look at the staggering numbers you mentioned, still the leading cause of death, 50%, if you look around the world, not have chance sort of like to equitable access to those innovations. So there's not only a gap, it's just like highly unequally distributed. And what makes particularly me so excited about the partnership, and frankly speaking grateful, is just simply an acknowledgement that we are firmly believing in Roche that the future, in order to address this, really lies in public-private partnership. And coming back to UICC, you are the big convener in the global cancer community. And we don't find a way that we bring governments together and patient organizations and the private sector and the public sector. I think you are core and essential to address those challenges.
Yeah, I think you're so right, because we really need this multi-stakeholder approach in order to be able to sort of meet such complex issues that cancer is. And I think we see, as you mentioned, we see so many tremendous advances in cancer care and treatment and early diagnosis, and the research that you and so many other different stakeholders are doing is instrumental, but at the same time, there's a bit of a frustration that we still see the increasing gaps, and the number of cancer cases increasing in the low and middle income countries that are least equipped to actually meet these challenges. That's a bit of a frustration. At the same time, I see so many advances that we can see, for example, now in early diagnosis and the use of AI and new technologies in new vaccines and immunotherapy that can really make a huge difference for people. But I also see that we need to shift in how our health systems are equipped and have a more sort of people-centered approach in terms of cancer care and meeting the patients, the families, the communities. What we've done so far has served us well, treating the cancer, but we need a more people-centered approach in the coming decades. I don't know if you agree with that.
I would totally agree with that. I mean, like my core profession still, yes, I did a stint in public health, but I'm an economist by training.
So am I.
And I'm a firm believer that if we look at it at cancer care at the global scale, I think what we need to manage and address is we need to prevent what is preventable, because we need those resources for the patients where you cannot prevent, and they need to get access to those treatments. But there's so much inefficiency also in those healthcare systems around that. And again, I think the key lies in those partnerships and bringing the right people together. But I also acknowledge it seems to be a little bit of an uphill battle. And if I look at it zooming out, like from a global scale, and if I look at the geopolitical trends, and then we have climate change, and then we know that Western countries, there is talking about lowering their contributions to global health. So it's more than ever in 2025 an uphill battle. So what would you foresee for us together? What are sort of like those challenges we need to tackle specifically together in 2025 to have a chance to really change the trajectory?
Well, I think we need to find new ways of addressing inequities and to find ways of how to work together. And I think you mentioned to me, and when we had another conversation, that we really need to connect the dots and see that with a more polarized world and more inequities and so many things that we're doing in different silos, and there are so many things that are already on the agenda. We need to find a ways of connecting these dots in order to not continue to working in silos, but to be more sort of effective in the way we're working together, and see that how can we actually 1 + 1 is 3 when we're working together, and find be more open in our dialogue. I will put the sort of the challenge in the middle of the table and see, well, our approach is this, we can add on that, and we can add on that, and to be quite open and see, well, maybe we can't solve everything, but we can actually bring something to a new level, to the next level, and then we'll go from there.
I really think we need also to get an alignment about like what do we want to achieve, like what are good outcomes look like. I think we are really good in the sense of defining a great clinical outcome around that, but we need to become way more better in listening to patients and what is truly the patient relevant outcome, and then design those systems with the patients together.